Many questions on the EPPP exam are shaped by ethical and professional boundaries. These boundaries define what actions are appropriate within the role of a psychologist, and they often determine the correct answer even when multiple options appear helpful. When reading a question, it helps to keep in mind that you are responding as a licensed professional. Your actions are guided by established standards, including ethical principles, professional guidelines, and, in some cases, legal requirements. These standards narrow the range of acceptable responses before you even begin comparing answer choices. A common feature of these questions is that multiple options may seem reasonable at first. They may reflect actions that could help the client or move the situation forward. The correct answer reflects what is appropriate within professional boundaries, given the details of the scenario. One area that appears frequently involves scope of competence. Psychologists are expected to work within the limits of their training and experience. When a situation involves services that require specialized knowledge or skills, the response needs to reflect that limitation. For example, imagine a psychologist is asked to provide treatment for a condition that requires training they do not have. The situation may feel urgent, and the intention may be to help the client. Accepting the role might seem like a way to provide support. The correct response involves recognizing the limits of competence and taking a step that maintains professional standards. This may include referring the client to a qualified provider, seeking supervision, or pursuing appropriate consultation. The key point in situations like this is that willingness to help does not replace the requirement for competence. The correct answer reflects what is appropriate within the professional role, not what feels helpful in a general sense. Another area that appears consistently involves confidentiality. Understanding when confidentiality is maintained and when it is limited is central to many scenarios. The decision depends on details such as risk, legal obligations, and the nature of the information shared. Consider a situation in which a client discloses behavior that could have legal consequences but does not indicate risk to themselves or others. The question asks for the most appropriate response. Multiple answer choices may involve reporting the behavior, warning others, or taking immediate action. A closer look at the scenario shows that there is no indication of immediate risk and no clear requirement for disclosure. In this case, maintaining confidentiality while continuing to work with the client aligns with ethical standards. Now consider a different situation. A client expresses intent to harm a specific individual and describes a plan. The details include a clear target and a defined timeframe. The question again asks for the most appropriate response. In this case, the presence of a specific threat and a plan changes the situation. The response shifts toward protecting others and addressing the risk. The correct answer reflects that change in priority. These examples illustrate how the same general concept, confidentiality, can lead to different responses depending on the details provided. The task is to interpret those details and apply the appropriate standard. Another pattern involves situations where ethical and legal considerations both apply. These may align, or they may point in different directions. The correct response reflects professional responsibility within the context of the scenario. For example, a situation may involve a legal requirement to disclose certain information. The correct answer reflects that requirement. In other cases, the situation may involve an ethical consideration that guides how information is handled, even when there is no legal mandate. The key is to pay attention to what the scenario specifies and to respond accordingly. You may also encounter situations involving boundaries, such as dual relationships. Some answer choices may involve actions that appear supportive or helpful, but create conflicts within the professional relationship. Recognizing those boundaries helps narrow down the correct answer. A useful approach when evaluating answer choices is to ask whether each option fits within ethical and professional standards for that situation. If an option falls outside those boundaries, it can be eliminated. This process reduces the number of plausible answers and makes it easier to identify the correct one. Another helpful step is to look for details that clarify expectations. Information about consent, risk, role, and context often points toward the appropriate response. These details are included to guide your decision, and using them consistently improves accuracy. Over time, these patterns become more familiar. You begin to recognize how ethical and professional constraints shape the range of acceptable responses. Instead of evaluating each answer in isolation, you evaluate it within the framework of those constraints. The goal is to incorporate this framework into your approach to each question. By doing so, you reduce uncertainty and make your decision-making more consistent. The correct answer reflects not only what could work in practice, but what is appropriate within your role and responsibilities in that specific situation.